he is aware of it. I don't know if he's just having some last minute connection problems.
You're now live on YouTube.
Okay, thank you very much for that. Welcome everybody to Calderdale's Health and Wellbeing Board, being live streamed on YouTube for August 2021. My name is Dr. Stephen Cleesby. I'm Vice Chair of the Health and Wellbeing Board, deputising as Chair today for Councillor Tim Swift, who can't make it. I believe one or two friends are still joining us, but I think we're ready and we'll crack on. So item 1 on the agenda are there any substitutes nominated for this meeting and any apologies for absence? Fazana, can you help us with that?
I think apart from Janet, have you got something?
Yeah, right, yeah.
Please,
Chair, they're in, Councillor and Mrs. Swift have sent apologies, and there are no substitutes.
Excellent, thank you very much. Yeah, I can see that Councillor Patience arrived as well. That's great. And sorry, I don't know, you haven't got your name on the screen, but it says Health Watch Kirklees is deputising. Oh, Karen, that's fine. Thank you very much, Karen. So you're deputising for Helen. That's wonderful. Great. Okay, so welcome once again to everybody. Item 2 on the agenda, members' interests. Remind members of the need to declare any disclosable pecuniary interests or other interests they may have in relation to items included on the agenda. Does anybody want to declare any interests for any of the items? No? Okay, that will be noted. Thank you very much. Item 3 on the agenda, admission of the public. Of course, that's in this virtual setting. It's not recommended that the public be excluded for any of the meeting for considering any of the items of business on the agenda. And I believe Robin's just joined us as well. Okay, item 4 on the agenda. The minutes of the Health and Wellbeing Board meeting held on the 10th of June 2021 to be agreed as a correct record. That's pages 5 to 12 on the document that's been circulated. Is everybody happy that those are a correct record of that meeting and happy for us to sign those off? And we'll just pause that for a second. There was a message in the chat box there from Councillor Fenton Glynn. Can I declare that my day job is for the General Medical Council, although I don't believe it to be pecuniary or related to the work of this board. But that means that I need to be on best behaviour as well, I believe. But thank you very much for that.
It's all right, I
Fenton
work on
Glynn.
training.
That's good. That's good. Thank you very much for that.
Chair,
yeah.
I could just declare my usual interest that I have a small share in a community pharmacy in Calderdale. Thank you.
Thank you. And that's been previously noted. Thank you, Councillor Wilkinson. Okay, so back to the minutes then. Are we comfortable that they are a correct record of the meeting in June? Are we happy to sign those off? Any thumbs up or? Yeah.
Yes.
From Julie Jenkins. Thank you very much. So we'll sign those off as a correct record. Are there any matters arising from those minutes that aren't picked up either in today's meeting or in the action plan that we'll look, the forward plan that we'll look at later on, Mike? Is there anything that we need to bring up at this stage from those minutes?
I don't believe so, Chair.
Thank you very much indeed. Okay. Question time. Item 5. Are there any questions from the public? Has there been a process by which that's been obviously advertised, but we haven't had anything in?
We've had no questions that I'm aware of, Chair.
Janet, have you had
I've
anything?
not received any either, Chair.
That's fine. Lovely. Okay. Thank you very much for that. So we'll get on to the substantive items. There are 3 items for discussion today. The first, and probably the most important, is the climate emergency progress update. So I think all partners have sort of sent in an update, which I'm taking that all members of the Health and Wellbeing Board have read. Councillor Scott Patient has joined us as well for this item. Councillor Patient, do you want to say anything in terms of introduction or to get us started? And then it might be worthwhile just going around the different members just to see if there's anything else that they'd like to share from what's going on at the moment. But Scott?
Yeah, thank you. Thanks, Stephen, Chair. Yeah, clearly this is a really important week for us to be talking about this after the IPCC's report that came out on Monday that was made for some quite stark and severe reading in terms of what we need to do to get to net zero and to avert some of the catastrophic climate change that we're seeing happening around the globe, as we're all too familiar with here in Calderdale. I think it's interesting that their suggested target for world governments is actually in line with our target on a West Yorkshire level and at the Calderdale level in terms of 2038. They're suggesting 2040. So I think there's some good synergy there in terms of how we need to approach this going forward. Clearly, it's not just the big polluters that need to, play their part in changing how they work. It's all of us. It's all of our anchor institutions to provide some of that inspiration for the people on the street to make those changes to their life. They can make the changes that they need, but they do need, I think, our help in terms of partnership and that collegiate approach to get where we need to go. So thank you all for sending in some of the ways your organisations are adapting and changing to address what will be the biggest health crisis that we've ever seen. The former DPH would have said, this isn't like COVID, this is important, this is an existential threat to how we live. And I do believe that's true. I think COVID will be a distant memory when compared to some of the challenges we're going to have to face longer term and how they'll manifest in and around health. So thank you for all of your submissions. I think a lot of good shared practice there that we can lean into and perhaps have a wider discussion about how we can install that. I think what's really important though is building on what we spoke about last time and actually the strength of the partnerships. I wonder if we might consider someone or other within this group to perhaps lead this going forward, maybe a champion within this group, and maybe think more broadly about how we might instill champions within each of our organisations to lead this agenda as well. So made for some really good reading. I started, I don't know whether they came through in order, but Together Housings especially was really good with quite a lot of content within there and maybe some stuff that we could share as well. I'm not sure where we're at, Debs and or Sam, with the ERP stuff and if everyone in this group has had eyes on that yet. I'm unsure, so I'm thinking it's a no. So it might be that the next time we have this discussion, you're able to look at that roadmap, and it may well make us consider what we want to do going forward, because it's quite a handy roadmap of how we can get to net zero and some of those challenges from transport to energy to land use. And I think there's ways we can each plug into that. So I won't go through what you've sent step by step, but I guess I'd invite either Debs or Sam to add any comments and then speak to any of your groups if there's any help or issues you had when writing that, or if you feel there's any support that you need, or what else can be done in terms of strengthening our partnerships.
That's great, Scott. Thank you. So yes, go on. Who's Debs?
Yeah, Chair. Thank you. I mean, Sam will be able to give some of the detail, but my suggestion, I think, is that we use a development session to actually look at the emissions reduction pathway that we've commissioned. That's about Calderdale, the place, and very clearly sets out the challenge, the things we have to do if we're going to get to our target of net zero by 2038. And what that does is it makes really clear the things that we need to do, but also the scale of the challenge, actually. And this will impact on every single one of us. And we are all going to need to think very hard about what we're going to do to scale up I mean, it's great to see the things in the paper, but actually, you know, as a council, for example, we know that we're going to have to, a lot of the things that we're doing now, we're not doing at the scale that's going to be needed for us to play our part. So my suggestion, Chair, is that we pick one of our development sessions and look at in quite a lot of detail at the emissions reduction pathway, and think about what we need to do individually, but also together, to reach our target. I don't know, Sam, if you want to say anything more about the emissions reduction pathway particularly.
Yeah, I suppose I had a bit of a technical point, but I think it supports what you do, which is, I think the responses for everyone were really interesting, and they contained loads of detail on a whole range of different actions. But something that struck me looking through it was that we didn't really, even in the council's response, try and quantify the amounts of carbon we were talking about. And we probably wouldn't think about having a conversation about coronavirus without talking about case numbers. And similarly, with the climate emergency and carbon, we need to actually start focusing on that. And through the emissions reductions pathway, that really does quantify carbon emissions. And I think it's been a really useful exercise internally at the council to sort of look at those quantities and the actions that stem from the need to reduce that quantity of carbon and compare that with where we're at, and kind of see that gap. And I think it's that gap analysis that we're finding helpful as a council, and that actually potentially the Health and Wellbeing Board will be really interested in when we think about that on a sort of borough-wide basis, because taking action is great and everything we're doing is amazing, but the scale of the challenge is something I think we need to start to somehow grapple with, and the numbers might be really helpful there without being too technical. Yeah.
I think as well to say just briefly is that, you know, clearly COP26 is around the corner as well. And I think we've got a really strong story to tell from Calderdale in terms of where we are at the moment. But, you know, clearly the IPCC report is, I mean, I've actually managed to read the bulk of it, which took a considerable amount of time beyond the headlines, and it is challenging, and it does back up what the ERP says. I mean, there's some stuff within the ERP about what we need to do in terms of increasing walking and cycling, and the percentage is sort of eye-watering really, but it's not untenable in terms of what we've seen during COVID and people ditching their car, and, you know, people really re-engaging with that sort of sense of place and the feeling of connectedness to nature and stuff. So it isn't outside of our grasp, but we are going to tackle it on a sort of health basis. I feel we need to start here. Calderdale's unique in the fact that sadly we don't have a university, or we don't have many of those sort of larger anchor institutions that a lot of the other boroughs within West Yorkshire do, but we do have really good and strong partnerships, and that's with the voluntary sector and with you guys and with our health partnerships, and that feels like a really solid foundation to build on. So yeah, I mean, I'd just back up what Debs and Sam said. I'd really like to do a dev session in terms of the ERP and what it means for us all, and I think we can go, thank you obviously for all your submissions, but I do think we can go far and above and beyond what's already there, and I think share some best practice where we can. So I'll just leave it there. It'd be really good and interesting to hear from some of you guys.
Thank you, Scott. Yeah, Robin, please.
Thank you, Chair. Just a bit of a kind of first of all, that sort of council take. I think Sam's right that the paper doesn't have a lot of information and stats, but there is a lot of information stats that we are using, and I guess it's probably something about depth and detail, but there's been quite a lot of discussion in other forums, I think the Climate Change Committee, but also a recent scrutiny panel, about the ways that we've worked through the pandemic and some of the sort of hard data around how that's changed travel patterns, the ways of operating, and these kind of ways of working, which has a part to play. So I think it might be good to kind of capture that and sort of have a single version of the truth in terms of where we are now. And that also includes some quite hard evidence around carbon reduction, doesn't it, around our estate, and where we're consolidating and where we've got achieved around a 30% carbon reduction around our buildings already, with actually more opportunities around some of the capital programme. That's one thing. The other thing to say is also, I think that we've been looking at air quality as a leadership team in the council. I think the jury's out about what we are improving. I think that maybe to some extent we're improving comparatively rather than necessarily getting to where we need to be. but it does appear that, relatively speaking, as a place that we're seeing some improvements on reducing air quality. So we need to do some thinking about that. And then in terms of sort of the NHS and the CCG, just it's highlighted in that element that Professor Peter Roberts has been asked to chair the Climate Commission in Kirklees, is involved in the climate change group, and I think it'd be good to involve Peter. And behind all of that, there is now in the NHS is quite a sustained focus, which is quite recent, and there's a number of posts being recruited to lead the carbon reduction agenda, some of them at the integrated care system level, some of them at a regional level. So I think you should expect to see, and I think expect to ask, the role of the NHS in this is going to escalate fast. So there's an opportunity there for us. Thank you.
Thank you, Robin. Joshua? Josh, do you want to come on in? Sorry about that.
Sorry, excuse me. Yeah, I mean, I think there's the thing that I was going to say is I think kind of thinking about a health and well-being perspective, there's quite a lot of win-wins in doing things seriously about climate change, and I think we need to kind of focus on those. And I'm always a bit anxious about the point that Robin mentioned about air quality, because obviously air quality is really important, but it's a different thing than climate change. And, we don't want those concerns to be used to, for example, criticise house building or something like that. Whereas actually, there's a broader question that we have to answer. But having said that, there is the, when you solve one, you solve the other. And I think things like, active travel has a win in terms of air quality. It also has a win in terms of general health of the population. If people feel safe to cycle, and if we kind of take some kind of slightly braver decisions on that, then I think we will see, fewer people, fewer of other issues, and also common respiratory issues. So I think we need to think about those win-wins, but also, I mean, Robin briefly mentioned our estates and how important they are. And that's a win-win as well in a very different sense, because obviously that's, the more we do to kind of reduce the carbon emissions of our estates, and, when we're looking at, renewing the Fernie care site, and, when we're looking at the railway view, we're making sure that we are using what technology we can to insulate those things properly. Not only is that good for our carbon footprint, but it's also, pushing down costs eventually. And I think that we need to kind of make clear that actually it's not just the right thing to do, but it's also thinking about the long term, the sensible thing to do. One other thing that I'd add, and I think this is one of those questions which has just been hitting me quite a lot recently, is I live across the road from one of our electric vehicle charging points, and it has one space for regular cars and one space for taxis only. And the regular cars one is full, I'd say about 80% of the time, and the taxis only one never has anything in it. Now, I think we're doing great work in getting our fleet green in terms of our cars, but I'm just wondering if there's anything more that we can do in terms of those emissions to get the kind of the taxis and so forth to move over to that as well, and how we can support that as a local authority, with obviously the air quality knock-on positives with that.
Thank you very much, Josh. Some great ideas there. Yeah, Councillor Wilkinson.
Thank you. Yeah, so we had a bit of a discussion about this amongst Cabinet on Monday, and we were specifically thinking about what more we could do in each of our directorates. And I think one big opportunity for CYP would be to sort of do more work with our schools, and also obviously also early years providers and colleges. I think in the education world, they've just been so massively occupied with what's going on with COVID over the last 18 months that probably this is probably another thing that they could really have done without having to think about. But obviously, it is an emergency. we do need everyone to be sort of playing their part. And I think hopefully as we move forward now, they might be in a more of a position where we can sort of refocus minds on this. And if you think about the sort of the collective carbon footprint of sort of all the schools and colleges and early years providers in the whole of Calderdale, you're talking about a huge amount of sort of journeys every day, huge amount of employers, lots of meals being made as well in the school canteen that perhaps, you know, we could move to more sort of plant-based meals and things like that. I know we've had some good work happening around sort of school streets and things like that, but I'm sure there are further opportunities. I think that's something for me and Julie and Leslie and others to think about. And also the fact that when you speak to children and young people, climate change always comes up as like the number one political issue or hot topic of the day whenever you ask them what their greatest concern is. So I think there's a real opportunity for us to sort of harness that enthusiasm for change that there is amongst children and young people and sort of look at what we can do amongst our education providers. Thank you.
Thank you very much, Adam. Yeah, very important points as well. Anna Basford from the Acute Trust from CHFT.
Okay, yes, thank you. I just wanted to come back in on a point made earlier around it would be really good to see an aggregate trajectory for Calderdale as a whole. I know in the Trust we've measured our baseline carbon and set a trajectory through to net zero. You know, we currently know that we're ahead of our planned trajectory, having seen a 31% reduction since 2013. But it would be good to see the aggregate and to really understand from now through to 2038/2040 what the scale is and how each of our organisations are contributing to that, and also potentially to create some shared system forums to do this in Calderdale, to share good practice. So I know in the Trust, through our sustainability strategy and our green plan, we have a raft of actions that are contributing to that reduction. But I think it would be really good to get some of our, and I'm not the lead for this area in our Trust, but to get some of our leads and some of that real sharing around insights about what's working, what's not, but also that we could amplify each other's actions, I suspect, particularly around things like transport and travel, use of our shared public estate, etc.
Thank you, Anna. Some great work then happening at the Acute Trust as well. And great to see that you're ahead of your trajectory, but still, I think even all the trajectories need pushing forwards as well, don't they? So does anybody else want to share? There's a suggestion around a champion from the Health and Wellbeing Board, strengthening sort of the collective picture around the data and the journey towards carbon neutrality, so we all know how we're contributing and what kind of support might be needed for some of the organisations who don't necessarily have that capacity within them to sort of be supported by place in terms of developing that data set. And then obviously the idea of having an informal health and wellbeing board and a wider discussion and look at more detail, and of course through the lens of the health of the population where there are win-wins. But I don't think we need to win the hearts and minds of the population. I think they're already won over largely, particularly the voice of young people, who this is the number one issue, as Adam said, in their hearts and minds, and they want something done about it. And if it's our responsibility, we need to crack on. So apart from those sort of suggestions, I think there's plenty of nods for, and we'll crack on and organise that informal session. Do members want to say anything else from any particular challenges that they've got within their organisations of contributing to this agenda? Or anything else you'd like to share, any highlights from the reports that were sent in before we close the item? Any further comments? I'll come back, if there aren't, then to Scott to see if he just wants to close it with anything from your perspective, Scott.
Thank you, Chair. Yeah, no, I think they're sensible actions, and hopefully we can get a lot of those put in place before we do the development session. I think what's sort of key when you look at councils when they're leading the climate emergency, one of the first fundamental things they need to do is have someone that's leading that. You need to be telling people about that and have very much having someone espousing what's needed to be done. So I do think that's key within this group, and I don't necessarily think that should be an elected member. I think that should perhaps be someone else within the partnership, because local government is local government and is great, but for some people it's another level of bureaucracy. So actually to have another voice from within this group would be really powerful, and also to be able to cascade that down throughout all of your various organisations, I think would be something equally powerful. But no, I mean, just to say, yeah, there is urgency on our side. I mean, clearly we want to go to COP26. Calderdale has really nicely just been nominated for a national award for our work in terms of responding to the climate crisis, but we want to build on that. We can't be complacent about that. Other places are also tackling the climate emergency, and so they need to. We do need to have that extra support from national government, but until that arrives in whatever form it looks like, it is for us and our partnerships to deliver that change that is ultimately going to be the biggest health crisis we've seen. So no, thank you, Stephen, for some of the helpful points you've outlined there. I think that development session, I think the member champion within there, and some of that stuff about how the partnerships work in response to the ERP will be really good, and we should get them done in short order. I think if we can make that something that is high on our priority list, that'd be excellent.
Thank you very much, Scott. And maybe, I don't know how we bring the voice of young people into that discussion as well, just to keep us real and that sense of urgency as well. One thing that just comes to mind as a back end of the discussion is that, there's several road deaths on Queen's Road, next to one of the surgeries we have, just over the last 12 months. So traffic, transport, congestion, health, accidents, this is all stuff that's live now and affecting the health of the population directly at this moment in time. So as much as we can do and as quickly as we can do it from a health perspective, I think it's so important. Okay, thank you very much, everybody, for that discussion, and we'll follow up on those actions as soon as possible and get the scheduled informal health and wellbeing board session in, hopefully with the voice of young people alongside us as well. Very good, thank you, everybody. Right, back to the agenda then. So that was item 6. On to item 7. I think we're making decent time as well. We're keeping to time. So this is from a scrutiny report on supporting carers in Calderdale. And I believe Ian is going to lead the discussion on this. So over to Ian, please.
Thank you, Stephen. As Health and Wellbeing Board members will know, Health and Social Care Scrutiny undertook a scrutiny in a day review of our system response to COVID, and tasked Health Wellbeing Board to oversee and seek assurance on a number of recommendations that were made out of that review, and there were some specific issues related to carers. So what this presentation is going to try to do is just kind of set in context kind of how we have responded to carers during the pandemic. And in fact, the pressures of the pandemic continue, as we know, to be experienced. And so some of our normal services have not yet fully resumed, but we've adapted and been agile about how they're delivered. So carers are specifically still feeling the impact of COVID and on their caring relationship. So one of the key requirements of the scrutiny recommendations was that we would assure the Health and Wellbeing Board of the work that we are doing with carers, but also look at reviewing the carer strategy, and with an ambition that we will have reviewed and refreshed the carer strategy by the end of this calendar year. We are committed to making sure that we co-produce that with carers, so that it isn't just an officer perspective, but actually we hear people's lived experience about what it's like to be to be a carer. I think one of the things that we wanted to kind of highlight here as well is that we, in all our organisations, will have employees who are also carers. So we need to make sure that our approach to supporting working carers is clear and consistent. So I think it's really important that we don't lose sight of that. It's clear that through the pandemic, carers had a number of challenges to face. Some of the services that they would normally access and the support they would normally access weren't able to operate in that way. And I think what you'll see through the papers that were circulated is that what we were able to do is no services technically ceased. What they had to do is focus and prioritise. So, for example, where a carer respite might be around the cared for person going into daycare, what we were able to do is maintain daycare operating for a small number of people. We were also able to adapt some of the workforce to do outreach work to ensure that carers could get suitable breaks. And that continues today, although we are trying to step back up to normal operating services. But obviously with the level of community prevalence, there are some kind of workforce resource issues that are kind of slowing down that progress. What the report also goes on to look is about how we have responded to not only adult carers, but recognising that there'll be young people who care, and the innovative ways in which we've attempted to do that. And I think some of the ways in which we've adapted to the pandemic will become quite key features because people have responded quite well to them and engaged well with them. So some of them will continue as we start to reopen traditional services. What we've tried to do at all times is ensure that people have had access to the right support, advice and information. And obviously that's been critical. We do have a number of directly commissioned services, and they will continue to be supported. We've also focused on physical and emotional well-being of carers to make sure that they can be resilient. We are engaged with the integrated care system on carers, and there's a specific work programme on carers, and we learn a lot from the wider system, but we also contribute to the learning of that system. We have continued to use direct payments for people who are direct carers, and that's been really helpful and offers some flexibility about how that personal budget is resourced. I think what we also did is attempt to bring in some additional resources, recognising that as the pandemic continued, caring relationships at points would be under pressure. So we very early on, as you will be aware, commissioned a model around Cedar Court that provided respite for carers, and that was well received, and it allowed either for the cared for person to go to Cedar Court for a short break, or in some instances husband and wives went and actually took it as a kind of weekend, almost like a weekend break, and that was highly valued by people. And we will continue to look about how we can make models like that work. And as I said, what we will be doing with Health and Wellbeing Board is bringing in draft versions of the strategy, so you're able to comment and influence its shape. But work is underway with all system partners and carer networks to make sure that that can be co-produced and co-designed. So hopefully that gives you a flavour of how we've responded. But if there are any particular questions, I'm happy to take them.
Thank you very much, Ian. That was very comprehensive. Are there any questions or comments around actions that have been taken to support?
Could I come in, please, Stephen? It's Julie Jenkins.
Yeah, of course, thanks.
Thank you. I can't find my hand. I've been looking for it and I can't find it.
It's usually just on the end of your wrist.
I just thought I'd share with the Health and Wellbeing Board just a couple of facts and figures around young carers in particular in the borough. And we do have an in-house service that supports young carers, and they usually are those young people who are really at the top end of that kind of caring responsibility. And we get a lot of referrals in from schools. So we've got 403 young carers being supported by the specialist service at the moment, nearly an equal split between boys and girls. But in terms of the council's priorities and tackling inequalities, we do have a large percentage in Ovenden and a large percentage in Park Ward. Those are the two biggest ward areas where we are Oh, thanks, Neil. They're the two biggest ward areas where we are supporting young people, and in the areas of less deprivation, there are less young carers there. I imagine that there's a more family network and more people around to support the carers. I think Ian's spot on in what he said about that kind of, the fear during COVID when you're caring for somebody who is, who's got a condition that could be quite severely impacted. That face-to-face support, had to be limited, and people were worried about, visitors to the home. But we've done a lot of creative things online, and you'll see from the PowerPoint presentation, we've touched on this at the Health and Wellbeing Board before, the difference that arts and craft, getting creative, lots of baking sessions, etc. Have been done with young people, but that face-to-face is so important. So we have done a lot of walk and talk as well. So, meeting young people out in the park, doing things in the fresh air safely, just to reassure the Health and Wellbeing Board that, that face-to-face support has continued as well. Thanks very much.
It's really important to hear. Thanks, Julie. Okay, any other updates from other members or any questions regarding our response, I guess, to this report, but also what's been going on throughout the whole of the pandemic, and then the refresh of the strategy that's sort of in the pipeline as well. Ian, please.
I just thought it'd be useful just to, on the back of what Julie was saying in terms of the overall numbers and the kind of representation across wards, what you see in terms of adult carers is that is much more evenly spread across all wards. So for elected members, it's a consistent ward issue across all wards, and I think that's quite significant. And apologies, one of the things I didn't focus on was we worked with the whole system, and particularly the CCG and NHS colleagues, to identify early carers as a discrete cohort being prioritised for the vaccination programme. And I think what that also did, it was allowed us to understand those carers who we are currently in contact with, but it meant we were also able to reach out for those carers who were not yet engaged with the system. So we've been able to create a bigger communication system. But I think we were able to bring forward and offer vaccinations to carers much more quickly than other systems. And I think that's something that we should be proud of.
Absolutely. Yeah. Robin, please.
Thanks, Chair. So I think it's a really good piece of work. It's very comprehensive. The only thing I thought wasn't in it was we've probably got three of the biggest employers in the borough in this call, which is the council, the NHS and Together Housing, and our role as employers with a workforce of carers. So I think one thing the pandemic, just maybe particularly in the context of the pandemic, one thing it's really shown through, I think, is the way that we've worked has offered some challenges, but also some opportunities for our workforce that also have caring responsibilities. So just say that there is quite a considered piece of work building on the policies we already have about how we support our workforce who have caring responsibilities to be able to discharge those and do their jobs. And I think there's some advantages in actually how we work now. And the notion of an output-based a way of thinking about work rather than necessarily about which seat you're sitting in when you're doing the work, which I think has been a bit of a principle of presenteeism in the past. So just to sort of highlight that issue really, Chair, that there is, I think, and I know the NHS are looking at this as well. So we've got a lot of people who potentially can work differently and better and balance their caring responsibilities as well.
Thank you very much, Robin. Ian, and then Mike. And I was just wondering if whether or not from a Health Watch perspective as well, there's been anything that you've been, your engagement work, Karen, you've been hearing from the voice of carers. Ian?
So apologies if I didn't bring out strongly the element of carers as employees. And I think that one of the key bits of the strategy, it will need to address how we work as employers to support working carers. So I kind of did reference the element of we need to recognise that some of our staff will be carers, but I think we do need to make sure that we have refreshed our employee policies to make sure that we are working carer friendly, but recognising that there will be some opportunities and challenges that new ways of working will mean to helping people sustain their caring responsibilities.
Excellent, thank you, Ian. Mike?
Thank you. I just wanted to say, Chair, I want to say thank you actually to people who pulled this report together, because I thought it was a really useful sort of collation of everything that's going on. But it does talk about a revised care strategy being produced, and I think perhaps the Health and Wellbeing Board may wish to have a look at that and consider it and discuss it perhaps early in the new year when it's been completed.
Absolutely, yeah, thanks for that, Mike. There's a couple of comments in the chat box. Karen, I don't know if you want to come in. You've been mentioning concerns around discharge, and of course the whole idea of being in hospital and the challenge for carers of having their loved ones in hospital, not necessarily being able to be with them during the pandemic, home care provision and care homes. So some of the challenges that carers have been bringing to the attention of Health Watch. Karen, did you want to say anything in addition to that, please? And then Karen Jackson.
Yeah, what we hear is very much health-based, so where people are discharged from hospital and their carers are very concerned that they might not be able to care for them, they don't think they've got adequate care at home, where there's home care provision provided, but that again doesn't seem to be meeting the need of the people in the family, and then issues about care homes where the care home might be too far away, or and then the family will find it difficult to visit, or where people would like different care provided in a care home. So it's very much health based is what we hear.
Yeah, thank you. Karen Jackson from Local, you commenting there about the carer's passport. Did you want to develop that any further?
Yeah, I just thought it was worth mentioning that when we think about our employees, our colleagues, there is the idea of the working carers passport to help when we transfer between organisations, particularly important for those of us who are not necessarily statutory bodies. So perhaps we could promote that as well. I know it's the thing, as the SRO for unpaid carers with Richard, it's really important for us to get that embedded properly.
Yeah, I agree with that, Karen. Back to Ian.
I think I just want to pick up on the point that Mike was saying about wanting, proposing that we might want to see the strategy early in the new year. I'm wondering whether, a little bit like the climate change issue, whether there's part of a development session that we could use with Health and Wellbeing Board to make sure that you have properly influenced the direction of travel. So things like Karen has just suggested in terms of making sure that we're clear about kind of a carer's passport model, making sure that people can influence what the overall strategy looks and feels like, might be useful as well.
Yeah, thank you, Ian. I was looking for Anna from the acute trust perspective, and just to see what processes are at work in the acute trust, but I think she's dropped off the call. Because of course, yeah, absolutely, the health sector has got a large responsibility, and carers are a group that we are meant to be identifying, prioritising in terms of access into care for themselves as well. Health checks, annual health checks are meant to be offering in primary care. So it's important that the strategy incorporates all those elements as well. Okay, and Ian, is there anything you wanted to say in summary then for this item? Well, Anna's back just now. Maybe we'll just, if Anna connects, you could just ask. You got yourself back in, Anna. I don't know whether or not from the acute trust perspective, either for your employees or carers, or how you support carers and their role supporting patients. Is there anything you want to add, Anna?
Not specifically, and apologies, yes, I did a lost internet connection, so I had to rejoin. So I missed some of the previous dialogue, but in terms of the trust, we do have a large body of volunteers that work and support with the trust, and we have an active programme of support through our workforce and organisational development department of meeting with colleagues and taking that forward.
Yeah. One of the challenges is now that maybe sort of half of contacts with patients are on digital or telephone, how the role of the carer as a mediator between the patient and all that, how that is panning out, that's yet another aspect of this challenge for carers, isn't it? Okay, so in terms of sort of actions and next steps, Ian, what have we pulled out from those discussions?
So I kind of just like to thank people for the contributions, and I think it is really clear that we need to continue to focus on the important role that carers play across the health and social care system. And if we don't support carers, that will increase demand and pressures on the wider health and social care system. So it's important that we focus on getting this right. I think we are committed as a Health and Wellbeing Board to refresh a strategy that both takes into account the needs of working carers and carers more generally. I think what I'm hearing is that board members would be interested in influencing and shaping what that strategy looks like and not simply just receiving it in the new year. So we'll plan a kind of development engagement session with the board just to make sure that we completely seek your views. But I think as we've heard from different kind of organisations representing the partnership, there are some really good examples, and a little bit like the climate change issue, we probably need to exchange some of those. You've clearly had a kind of view of some of what we're doing. It's probably just the tip of the iceberg, and what we probably need to do is amplify that. So something about an information exchange on good practice would be useful, I think, as well.
Very good. Okay, Anna, please. I can see your hand there. Yeah.
Sorry, because I haven't got an icon and I got a bit flustered by being thrown out and coming back in. I did just want to. I don't think I answered the invitation when you asked me to comment very well. And just to say, in terms of carers and some of the support we've been and different ways of supporting carers during the pandemic that we're continuing to take forward, is some of the use of where we are using technology around enabling virtual visiting, connecting carers with their loved ones, and doing that in a supported way, particularly recognising that for some carers they may not be confident or familiar with using technology. Doing that in a way that supports the carers to use the technology. We're currently exploring providing that if they don't feel comfortable to do that in their own home, providing areas that they could come to themselves to make that connection, which would be more convenient. And similarly, throughout the pandemic, we've seen increased use of being able to connect carers into outpatient appointments with their loved ones. And that's not just carers who live locally in our local system area. We've been able to connect carers, from other areas across the UK and indeed from other carers. And I think there's some real learning from that we want to take forward, and the importance around families, carers and support for individuals. And technology is one of the ways that we can do that to make that connection. It's not obviously applicable in all cases, but it's been a real acceleration of being able to do that and make sure carers are more directly involved in those conversations.
That's great, Anna. Thank you very much for adding to your previous comments. That's wonderful, and some really good practice, which is the kind of thing I think Ian's talking about, sharing best practice across the different partner organisations. I'm just mindful of these 403 young carers. Is that the tip of the iceberg? Are we sure that we know all our young carers? And Julie, you mentioned some great things that are ongoing to support them, both digitally and face to face. But I guess they need to be a key priority area for us, don't we, to ensure, because they're likely to have a significant part of their life in that caring role. And it does shape who they are, the challenges they have as they get older, going into work and all these things. So we need to ensure that we're doing everything we can possibly to support them in different aspects of their life. So we'll probably pick up that conversation a little bit in the Health and Wellbeing Board agenda setting group and see when we can bring something back, development mode conversation, etc. And obviously look at the strategy as it's being developed and have a further conversation of that probably in the new year. Is everybody comfortable with that? Yeah, very good. Okay, the next item on the agenda is a COVID update, and customarily we go straight to Debs to head us off with this. How long can we put on the agenda for it? I can't quite see now. Anyway, we seem to be well on time anyway, so I'll hand over to Debs, and then maybe other partners can share as well.
Yeah, I won't be long, Chair. So just a little, just some numbers, just to start with, as is the custom that we usually do. So the most recent data, 31st of July to the 6th of August, that 7-day period, we had 830 Calderdale residents tested positive, and that gives us a case rate of 393. That's a reduction of 1% from the same day the previous week. That makes us the 23rd highest local authority in England on our COVID-19 case rate. And as you know, we peaked around mid-July with a case rate of about just over 550, which is the highest case rate we've ever had in the pandemic. We then reduced, and we've seemed to have settled a level of sort of high 300s, just under 400 for the last sort of week or so, really, week to 10 days. And obviously, we've never been in a position where we've had a case rate this high without any restrictions, and this may be the natural level of cases in Calderdale when children aren't at school and when we don't have restrictions. So we're in really uncharted territory, and we don't really know what's going to happen. We know that Calderdale tends to settle at a higher case rate than other areas of the country because of living and working conditions and the nature of our economy. Just to say, though, the really good news, I guess, and the celebration that we should be having, I guess, and the hope relates to the vaccination programme, which is a complete team effort, you know, real team effort from colleagues from the NHS, the council, and our amazing voluntary and community sector. So I just wanted to just give some highlights and hopefully not steal Neil's thunder, more about not about the detail of the vaccination programme, but how it's sort of playing out, if you like, in terms of what's happening in Calderdale. So at the moment, as of last week, 82% of Calderdale adults had had 1 dose of the vaccine, and 70% had had 2 doses of the vaccine. So that's the overwhelming majority of people right across every age group in Calderdale have taken up the offer of the vaccine. And we know, and we can really clearly see that 2 doses of the vaccine is weakening the link between COVID-19 and serious illness. And we can really see that in the number of deaths that we're having and in the hospitalisations that we're having. And we know that the more of us that have 2 doses of the vaccine, the weaker that link becomes between getting COVID and becoming seriously ill. And we know that every single vaccine gives us hope of being able to enjoy the things that we used to take for granted and moving on to that new normal. And it also, I think, is really important, is it also giving hope to those people in our communities that have health conditions that mean that either the vaccine won't work as well for them, or they can't have the vaccine, and it gives hope that they can be protected as well from serious illness. So I think just to really say, and colleagues from other partners will talk about where we are in terms of you know, the impact of COVID on demand for health and care services. But I just really wanted to celebrate the achievements of the vaccine, and it's the reason why, although we've got extremely high case rates, you know, many of us are able to enjoy some of the things that we've not been able to for a very long time. So I'm going to stop there, Chair.
Some great news there, Debs. Thank you very much indeed. Okay, any other members would like to share anything, either about current challenges, updates from their perspective on where we are? Neil, please.
Thanks, Chair. Just sort of following on from what Deb's said around the vaccination programme, and we've got really good success so far. We've got another pop-up at the Peace Hall this week, and people will have seen in the news this week the change in the guidance to have younger children, particularly the 16 to 17 and 3/4 age group. So whilst we aren't publicising that, we are welcoming those younger people to the Peace Hall and to other of our centres this weekend. I think the challenge going forward is we're moving into what's called phase 3 from September, where we will be looking at boosters for predominantly the JCVI groups 1 to 8, which is the over 50s and the care home and health and social care workers and carers. This places a huge amount of pressure on our primary and community staff to deliver that. I don't think we should underestimate the amount of effort our GPs and their workforce and our community pharmacies have done in the last 6 months, and to be doing it again for another 5 months will have huge impacts on our ability to respond to the day-to-day demands of general practice. We're seeing, I think, across the system on some of the West Yorkshire calls, huge fatigue in workforce. We're seeing high absence rates, and maintaining access to normal services and delivering a fantastic vaccination service is becoming increasingly challenging. We're seeing sort of winter impacts on hospitals and GP staffs now. We're seeing huge increases in respiratory diseases that you'd normally see in winter, and the lovely norovirus is hitting hospital wards left, right and centre across West Yorkshire, which we normally see in winter now. So huge credit to the health and social care workforce for the last sort of 9 months in delivering services, getting back on track with the ease of restrictions, but it's going to be extremely hard in the next 6 months to do phase 3 as well.
Absolutely, it is indeed. Anybody else want to update? I don't know, Anna, from your perspective at the Acute Trust, please. Yeah.
Just yes, to reflect both what Debs and Neil has said, we have seen reduction in number of admissions for COVID. We currently have about 40 inpatients with COVID in the hospital, but what we have seen in recent weeks is a very increased demand around patients coming to hospital and through our emergency departments with non-COVID conditions. And that, alongside, as has been referenced, we've seen high workforce absence as well, has meant that capacity has been particularly challenging to meet that and the pressure within the hospital. We continue to remain focused around the recovery of our elective workloads at that same time, and at the moment in the hospital, and as is the case across all hospitals, we continue, whilst there's been an easing of restrictions out of hospitals. Hospitals are currently following current national guidance, which continues to maintain the infection control measures around PPE and distancing within the hospital. So it is challenging. It is pleasing to see the reduction in the numbers of COVID patients admitted to hospital, but I think as we had anticipated, there is a huge demand amongst our population coming forward.
Indeed. Thank you, Anna. Ian?
I think from an adult social care perspective, I think the last couple of weeks of, like others have echoed, is that it's been quite a difficult period. So we'd had several weeks, in fact months, of no formal outbreaks in any care settings. And over the last few weeks, we've seen an increasing number of both outbreaks, workplace outbreaks, where we can describe clusters of positive cases, but with no relationship to workplace transmission, and single cases, and that's across community settings, home care, residential and nursing. So despite a really high level of vaccination take up, we are still seeing positive cases occurring. So a little bit like the acute trust is suggesting, we're still kind of working with the kind of infection control guidance, but it is a worrying issue at the moment, and it's what we are seeing is this week is a slight decrease in numbers, but I think what we'll probably see in the next few weeks is a bit of fluctuation. So whilst we still have relatively high community transmission, it continues to be a risk. Clearly, the vaccination is helping in terms of ensuring that those who are vaccinated, fully vaccinated, are not having the same acute experience. But also, we've probably experienced a recent care home death related to an outbreak, which actually was the first since April. So we had gone for some time. So it's obviously our thoughts go out to the family and the care home who had worked tirelessly to keep COVID out of the home. So I don't think we're completely out of the woods yet, and I think we just need to keep an eye on the current patterns and trends. I suppose the other issue I would just want to kind of flag with Health and Wellbeing Board is, of course, we know that there will be a requirement for mandatory vaccinations in residential and nursing settings that formally will come into place. It has to be achieved by November, but a key date of the 11th of September where people would need to have had their first dose. So we have been working with colleagues to understand what that profile is. Overall, the take-up has been high, but we have seen some pockets where staff have not yet had their first dose. So clearly, if for whatever reason those staff choose not to take the vaccine, we may also see an issue around retention and workforce capacity. So we are trying to work with everyone to make sure that we've kind of kept an eye on that. Thank you, Stephen.
Thank you, Ian. Yeah. Daryl? You're just on mute. You're just on mute at the moment, Daryl. Still. There you go.
Sorry, the technology didn't work in quite the same way as on Teams. Apologies for that. From a mental health provider point of view, just to echo all the comments, we're feeling significant acuity in mental health. Our staff absence is holding steady. We are anticipating with increased community presence of COVID that will begin to increase in spite of vaccination. I guess the other thing that we are also finding is that people who are admitted are, if they've had both vaccines, might be less happy to isolate. So I think we have the whole balance of the community perception that we're moving forward with COVID now with regards to what's expected of us, and the NHS perspective that our safeguards still hold. And that is quite a challenge for particularly our colleagues on the acute ward, but generally demand is high, as you would imagine.
It is indeed, yeah. The mental health burden, emotional well-being has been significantly affected, and we're seeing that both at the high level of acuity that you're mentioning, Darryl, but right down to those presenting in primary care, and I guess also in accident and emergency departments with anxiety, stress, chest pain, panic attacks, all kinds of different symptoms. Yeah. Councillor Fenton Glenn?
Yeah, I think kind of just to build on what Ian said, I think the risk now, and kind of also building on on Darryl's comment, the risk now is that there's almost a perception that the pandemic is over because the rules have changed a bit. And I think particularly, when the press is talking about what you have to do to go on holiday, people don't think about what they have to do to keep care home residents safe. And I think we need as much as possible as an authority to get the message out. And, obviously us versus government comms isn't the best match in the world, but to get that message out that actually the simple things to keep people safe that can be done, and kind of the straightforward steps. And I say this with my child sent home from nursery, watching Frozen in the next room. Doing those sensible, basic things isn't just about making sure you can go on holiday. It's about making sure that someone who works in a care home doesn't get it. Because actually, a mild case from someone in a care home, if they're a particularly vulnerable adult, might be a much more severe, even if it is fairly, what might be in a healthier person, mild symptoms. So I think anything that we can do for our comms channels to kind of push out, you know, that this is about stepping up and helping some of our most vulnerable citizens is really important for us to do.
Yeah, I agree entirely. Thank you. Karen from Locala.
Thank you. I just wanted to add something on behalf of all community providers. I know you've heard from the Acute Trust and they provide community services as well. There is pressure in community services. We're working really hard to support the elective machinery. So making sure people are properly prehabbed so that they go in from a very positive place and their outcome is therefore likely to be better, and then rehab. We are also working hard to support in terms of discharge, but also through the UCR and other ideas that we've got, making sure people don't present in A&E when they don't need to. Added to which, we have our own lists to manage, which we are really managing, and we have staff pressures too. So we are working across the system. I just wanted to recognise the work that all community providers are doing in there and working really hard with others in the system. In terms of our children's services in Calderdale, they are pressurised. We are seeing different degrees of presentation for different reasons, and we're working really hard with our colleagues in Swift to make sure that those presentations are appropriately managed. So just on behalf of community services linked with general practice, thought I'd add that and just say, you know, we're on with staffing's not so bad, and we're working together to form resilience across the wider footprint where we can, so that we can support across the whole footprint, given the acute provider provides across 2 footprints. So just thought it was worth saying thank you.
Thank you, Karen. Okay, anybody else want to say anything before we close this item? I mean, it was just generally for update, I guess. I don't know if anything's come out of the discussions that would lead to anything that needs to be followed up in terms of action. But one issue that's, I think, is definitely on our hearts and minds, and a significant challenge, is the mental health burden that COVID has created. And I don't know whether or not we should consider, as a Health and Wellbeing Board, at a future meeting, just what's the response, what's the impact, what are we doing about it, particularly certain vulnerable groups like children. Obviously, we spoke about young carers earlier on. So by the time you're a young carer, and then the impact on your mental health, some of these things summate and become very, very difficult and challenging. So again, I don't know whether or not that would be something that we could consider in a bit more depth, the mental health challenge of COVID at a future meeting. Again, we could take that into the agenda setting round and see what can come out of that. Okay, so that's items for discussion. There are a couple of further items. Item number 9 is homelessness and rough sleeping strategy. So that was quite a long report that's in there. I'm taking that's been read by everybody, and it's not for significant discussion, but if there's anything that anybody wanted to bring out or question the board on in terms of that particular report, anything significant. I know we've got a few minutes to be able to spend on this, rather than just taking it for information only. Mike, did you want to say anything about it being here and what we might want to do in terms of noting it?
I was just going to say, Chair, that Heidi Wilson is in the meeting and she's leading on this piece of work. So she may, given we haven't got a bit of time, Heidi might want to say a few words about it.
That's helpful, Mike. Thank you very much. Yes, thank you, Heidi. Do you want to say a few words about it?
Thank you, Stephen. I do believe this is coming back to a future meeting for further discussion, but hopefully colleagues will have seen the strategy. It very much is a partnership piece of work, and I think it's really important to emphasise that. Many of you will appreciate that homelessness and rough sleeping, the solutions to that are not just about putting a roof over somebody's head, although that is often a really important point to enable us to deliver other services and to support those people. So it really does have to be a partnership response. And we've had great input from colleagues who are at the meeting today, CCG, Public Health, Swift and so on, but also a wide range of other partners from the voluntary and community sector, homelessness and housing support providers, housing associations, the BCI Alliance, etc. So a wide involvement in terms of the response. And there is an action plan at the end of the report that looks at 4 sort of themes or strands to the work that are cross-cutting actions, prevention, intervention and recovery. And I won't go into detail today because it is just for discussion. But just to really say that I think when it does come to a discussion item, there's some really exciting new pieces of work that we can talk about, new pathways that are being developed with partners, new services that are being put in place to respond to needs. But there are also some challenges, and it'll be really interesting to hear from partners about how they see us being able to deliver against this agenda, how they can be involved in being part of the solution. But just to say that, you know, colleagues are already involved and a part of what we're trying to do. And to link with another piece of work that I know this board have looked at previously, one of the actions within the strategy is around the Burnt Bridges report and making sure that we deliver through our strategy the work that's been done through that piece of work as well. So I won't say any more, but obviously happy to take any questions or comments that colleagues might have. Thank you.
That's fine, Heidi. Thank you very much. Yeah, the action plan looks really strong on those 3 broad agendas of prevention, intervention and recovery. And if we've got a more substantive discussion about it at a future board meeting, that's great. Are there any questions for Heidi about any of the content of the report? No, we're okay. That's fine. Great stuff. Okay, so final item on the agenda is the forward plan for October. Again, it's just for information, just to check that we've got everything picked up, and if there's anything that needs to be done in to get us ready for that. But no doubt Mike will have that all in order. Yeah, Mike.
Thank you, Chair. The only thing that I'd like to add is that I had a conversation a couple of weeks ago with Ken Barnsley, who's working with Debs on an age-friendly borough, and he was talking about how he thinks it would be a good idea to have a discussion here about an age-friendly borough at some stage. So I did say I'd mention that under the work programme, but we can discuss that in detail at agenda setting. But it does seem like a cross-agency important piece of work and a priority that ought to come here to either the October meeting, although that looks quite full, or the December meeting.
It does look quite full in October, but I agree it's an important topic to discuss. Does any others, is there general support for that item, an age-friendly borough, for us to consider that and bring that to a future meeting? Yeah, a few nods. Very good. Okay, right. I believe that takes us to sort of close of play for today. Thank you very much, everybody, for your enthusiastic participation. And you've got sort of 45 minutes back to catch up on other things. Have a good day. Thank you very much. Have a good walk, get some exercise. And we'll